Here at York University campus in Toronto, we're situated on the traditional territorial area known as Tkaronto. And we acknowledge its current treaty holders, the Mississaugas of the Credit First Nation. We also acknowledge this as the traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat and the Métis. This territory is subject to the Dish with One Spoon, One Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Let's begin with a brief introduction to our speakers. Professor Godfred Boateng is a Canada Research Chair in Global Health and Humanitarianism at the School of Global Health. At the Dahdaleh Institute, he's the Director of the Global and Environmental Health Lab. Professor Boateng's work focuses on design and application of scalable methodologies to study multidimensional factors and processes that shape health and health equity among vulnerable populations. His research looks at resource insecurity, health, and sustainable livelihoods, the socio-ecological determinants of cardiometabolic conditions in aging adults, and quantitative data analysis methods and survey scale development. Dr. Gabriel John Dusing, I hope that I'm pronouncing that? Thank you, holds a PhD in mathematics from the University of Tennessee. His research uses linked longitudinal health administrative data and employs techniques such as survival analysis and difference in differences to examine complex social and health issues. He's been published in several leading journals where he addresses critical topics such as mental health, population health, and the social determinants of health. So in today's seminar, Drs. Godfred and Gabriel will share their research looking at the effect of record-breaking heat waves on the health and environment of those residing in sub-Saharan Africa. Specifically, they assess the sleep quality and cognitive decline in relation to heat among adults over the age of 50 using structural equation models and accounting for data clustering. They'll then offer some recommendations of climate mitigation and adaptation practices aimed at mitigating the effects of global warming in low and middle income countries. So this is a 1-hour event that'll end at 2 p.m. We'll start with a 20-minute presentation from Drs. Godfred and Gabriel, followed with a 30-minute question and discussion. We'll then wrap up at around 1:55 p.m. to conclude at 2 p.m. So now I'd like to ask Drs. Godfred and Gabriel to begin their presentation. Over to you.
Sure. Thank you so much, Mary, for this time, and thanks to everyone who made it, those here present and those online. This afternoon, we are excited to present one of our studies that's titled Increasing Ambient Temperature Disrupts Sleep and Impairs Cognitive Function. This work was done collaboratively with Dr. Gabriel John Dusing, and it's exciting that this work has come this far. So I would like to start with some background and context to this study. The health burden of climate change is staggering, ranging from temperature-related illnesses and deaths, air pollution and wildfire risks, and more across the age spectrum, and we are looking at from infancy to older age. Climate change hazards such as heat waves, droughts, and wildfire are not only increasing separately, but also are more likely to occur concurrently or sequentially as compound events from a combination of spatially and temporally dependent physical processes, challenging adaptive capacity of systems and human resiliency to withstand their effects. These dependencies lead to a more complex and correlated patterns of climate-related exposures that require new and transdisciplinary methods to accurately assess their cascading risk. And so you find that infants, children, and older adults with compromised immune systems and energy-insecure households without electricity or air conditioning are more vulnerable. as well as individuals with compromised health systems or who are at risk of cardiovascular diseases are more at risk. The year 2023, that's last year, was the warmest since global records began in 1850 at 1.18 degrees Celsius, above the 20th century average of 13.9 degrees Celsius, and the graph depicts it quite clearly. In addition to it, we do know from the literature that exposure to extreme climatic conditions is estimated to cause over 5 million deaths annually, accounting for about 9.43% of all deaths globally. And extreme temperatures above an absolute of 35 degrees Celsius results in these health effects, both direct and indirect effects. So that direct effect could be looked at as heat stroke, cardiovascular diseases, and the indirect effect would also focus on reduced access to healthcare and other effects that are not mentioned here. But we find that when you move out of the global space, Africa, or sub-Saharan Africa for that matter, is accustomed to stretches of hot weather. And so if you're coming from the place, you know that consistently there is that. But we currently facing extreme heat, or the continent is currently facing extreme heat, and nighttime temperatures seem to have gone up, and this is all due to climate change. Temperatures now soar above 40 degrees Celsius in certain regions on the continent, with devastating consequences for the health of infants, children, as well as older adults. But as was mentioned, we'll be focusing more on older adults today. In fact, the state of the climate in Africa 2022 report shows that the rate of temperature increase in Africa has accelerated in recent decades, with weather and climate-related hazards becoming more severe. And so let's look at the motivation for this particular study, because the background I provided gives some context to why we are focusing on this. And as already mentioned, high temperatures have consequences for populations or subpopulations such as infants, children, and older adults, but particularly for older adults because of the dysfunction in homeostatic regulation, which makes older adults more vulnerable to heat. Also, increasing temperature has been associated with directly with a decline in sleep quality and cognitive function. But lots of these studies are more so in high-income countries as well as Asia, with fewer studies in sub-Saharan Africa. And so what do we know? What we do know is that, one, we know that there is a direct relationship between increasing temperature. If the thermal comfort in your household or in your room is not the best, it affects your sleep quality. But more so, if this continues for so long, for older adults, it has consequences for your cognitive function, right? But what we don't know is this same relationship and effect present within the African context? Would it be the same? The findings we have in Europe and in the Americas, would that be the same in sub-Saharan Africa? And number two, no study, to the best of our knowledge, have looked at the indirect relationship between increasing temperature and cognitive function and how it works through sleep quality. And that is to say that does increasing temperature lead to poor sleep quality, and does the poor sleep quality lead to a decline in cognitive function? No study has examined that, and that is exactly what we sought. that's exactly what we sought to study in this paper. So we came up with three hypotheses, and the first being that increasing ambient temperature would reduce sleep quality. The second being that increasing ambient temperature would increase the risk of cognitive impairment or would lead to poor cognitive function. And the third being sleep quality would mediate the relationship between ambient temperature and cognitive impairment. That takes us to the methods, and Gabriel, you can take it away.
All right, thank you, Godfred. So for our study, we used two main data sources. The first one was the climate data or temperature data that we obtained from a data set published by the University of East Anglia, their climate research unit. The data set is based on collects climate data in a 0.5 degree longitude by 0.5 degree latitude grid worldwide. It's both ground-based, satellite, and interpolated data, so it's pretty comprehensive, going back quite a few years. Specifically, the data that we took, we averaged the past 3 years from the survey data set that we had. And the underlying survey data set came from the WHO, a WHO-run study called the SAGE, or the Study on Global Aging and Adult Health. We used data from Wave 2, which is, at the time of the writing, at the time of our survey, or study, the most recently available. As future waves become available, more studies can be done. Okay. So the measures that we were interested in, sleep quality. This was obtained from survey responses from two questions. They ask about whether the respondent has problems falling asleep, do they have trouble staying asleep, and when they wake up, do they have difficulty like feeling rested the next day. This is based on a similar scale as the Insomnia Severity Index, or the ISI, which are widely used in other studies examining sleep quality. And for cognitive function, we used 4 measures from the survey. There are 4 tests, two of which are kind of related. So the verbal recall test, the immediate recall test, and the delayed recall test, or verbal recall. Essentially, how this works is the respondents are given a list of words. In the immediate recall test or verbal recall, they're asked to recite the list that was read to them. And in the delayed verbal recall, at some point later on in the survey, they are asked again about the list that they were read that was read to them, and they're asked to see how much they're able to remember. So there's also the forward and backward digit span tests. So the forward span, so it works in a similar way, but with a list of numbers. They're asked to repeat a number, a sequence of numbers in the correct order, in the order that was read to them, and then they're asked to recite it again in the reverse order. So the way these we combine these verbal and numerical tests into a single score based on a method used in other SAGE studies, or using other SAGE studies. That is, their total scores, so the score for each test are rescaled using a z-score, and then combined, and then again rescaled to fall between 0 and 100. Lower cognitive scores indicate there's a higher odds of cognitive impairment, or higher risk of diseases that affect cognitive function, such as Alzheimer's disease and dementia. We also include other controls, such as smoking, smoking and body weight, or BMI, as an indicator of physical health, as well as socio-demographic indicators such as sex, age, and level of education. So one of the benefits of the SAGE study is that survey weights are included. This allows for our analysis to be generalizable to the wider population of the Ghanaian population of older adults. So the specific statistical techniques that we used include multiple linear regression and structural equation models. So the structural equation models were used to test that mediating relationship. And descriptive and bivariate analyses, we used the chi-square tests as well as t-tests to examine bivariate associations. This demonstrates the clustering of not just the temperature, but also the cognitive function. I'll give you a moment to take a look. So as you can see, there are differences, visual differences in terms of temperature as well as cognitive function. Okay. So the first hypothesis, whether does increasing temperature, ambient temperature, reduce sleep quality, and yes. As for each degree increase in temperature, there's a reduction, or there's an increase in the number of reported difficulties with sleep. And this is in spite of this relationship holds, despite for adjusting for covariates. As you can see, so for each degree increase in temperature, we see a 0.23 increase in the number of problems or difficulties reported in sleep. Likewise, for hypothesis 2, increasing ambient temperature does increase the risk of cognitive impairment. As we can see, even when we adjust for covariates, we see a 2-point decrease in cognitive scores with every degree increase in temperature. Likewise, there is also the direct relationship between temperature and sleep, as well as temperature and cognitive impairment aren't the only relationships that we see. We also see an indirect relationship. So sleep quality does indeed mediate the relationship between ambient temperature and cognitive impairment. Okay. And just to summarize, all three hypotheses that we had do hold. So a lot of the findings that we have from other contexts do generalize to the sub-Saharan African context. Policy implications, back to you.
Sure. So based on the results, we thought of some policy implications, but I'd like to add that when you take a look at the graphs quite well, you would find that with regards to older adults, the effects seem to be greater. Just take you back a few slides, and you would find right from the very first hypothesis that when you look at those less than 65 years, you would find that the effect on sleep is lower. But when you reverse code it, the effect on sleep is higher for those more than for those more than 65 years on sleep quality. So we do see that they do report a lot more challenges with sleep at that level. Similarly, when you think of cognitive impairment, for those less than 65 years, we do see that they have better cognitive function here. Reverse coded, it implies that significantly those more than 65 years do have lower scores when it comes to cognitive function. So age seems to play a very key role here when you are looking at the effect. Now, let's look at the policy implications. One there is a call to factor in quality of health assessment of older adults in research and policy on climate change. And that's to say that the temperatures are not decreasing anytime soon. Policies that have been put in place have not really come to that point of really pushing the temperatures down. And so if there's going to be an increase, thank you. If there's going to be an increase in temperature over the next 10 years, it tells us that this is going to get worse. And again, with the population structure of a number of African countries sort of narrowing towards an aging population. Currently, they seem to have a younger population, but in the next 30 years, we do see an older population, which is more prevalent in sub-Saharan Africa. This calls for urgent policies to be put in place to secure or to ensure that the effect of climate change is mitigated at that level. This is sort of a warning saying that there is trouble ahead. Even with current temperatures, we are seeing the effect. And mind you, when you think of sub-Saharan Africa, or Ghana in particular, not everyone has an air condition in their rooms. And the daily temperatures sort of do not cool off immediately at night. So these temperatures range on, and the building materials used end up sustaining or containing these temperatures for longer hours, right? And so if this is going to be the case, then we are seeing that the effect is going to be greater for these populations. And so within the Ghanaian setting, there are policies that have been targeted at rolling out some cooling systems for households. What we find from the studies, a number of times for those in the rural areas as well as those in informal settlements are more at risk. And so the hope is such policies should be tailored to those specific areas and to be tailored or targeted at older adults. And 3 comprehensive measures of resource security with a focus on older adults. I think for so long, a lot of the policies that have been implemented have targeted the younger population, less on older adults, since the notion has been it's not an aging population. But taking into account what we know from the World Bank and other reports on the structure of the Ghana's population in the next 30 years, the hope is some of these policies should be targeted at them to ensure that once we get there, we would have planned towards it. But then again, we are looking at a global event here. We are looking at global warming, and it is something that needs to be catered for. So apart from the effects, we do see on land, the effects we do see with enteric diseases because of flooding in some of these places, and vector-borne diseases because of mosquitoes that are coming out of hotter temperatures. The hope is the government of not just Ghana, but of other sub-Saharan African countries need to pay particular attention to how we address the challenges associated with climate change. And so these are some of the things we have thought about, and I would at this point like to acknowledge my our collaborators from Dahdaleh University and University of Memphis, as well as the University of Ghana and the University of Western Ontario, and for sure our research coordinator, Iram, for putting some of the slides together. And again, for funding from the Canada Researchers Program, as well as the Dahdaleh Institute for all this support. Thank you, and we look forward to questions.
Well, thank you so much, Godfred and Gabriel. That was really, really interesting. You know, as a person who's getting older, I'm also experiencing, you know, those kinds of things. So, and I noticed you focused on women, so you didn't discuss it too much. Could you elaborate a little bit on, you know, how it affects women more? And part B to the question, you referred to some policies that might be able to address the housing policies and so on. Wondering if you could give some possible suggestions of what is out there in terms of especially addressing, you know, the informal settlements and what could be done.
Okay, thank you so much for that question, and certainly I feel like I've gotten this question somewhere before, but the issue is the effect we saw with older adults is the same effect we find with women in this population. And just from the graph on the screen, you do find that this is in comparison to females. And so when you flip it, we are seeing that females tend to have more challenges with sleep. And that is almost the same when you think of, no. Okay, so the first had to do with sleep. The second had to do with cognitive impairment or cognitive function, and we do see the males seem to have better cognitive function than the females, and so reverse coded, we see a deficit with females when it comes to cognitive function, right? And the case here is the entire population you are looking at would be 50 and above, right? And so this would be between 50 and 65 and 65 years and older, which implies that probably the emphasis is not just on older adults, but a combination or an intersection of factors. And so it's not just older adults, but you are also looking at women who may be facing some of the severe consequences associated with temperature. And you brought in the informal settlement. Certainly my work on resource insecurity that showed that you have probably 70% of those living in informal settlements in very vulnerable situations being women, right? And if that is the case, probably this whole thing about gender mainstreaming, which was introduced during the structural adjustment program phase, had some positive benefits to various countries, not the structural adjustment program itself, but that gender mainstreaming component. So the hope is when it comes to climate adaptation and mitigation strategies, they need to also focus on women, but also older women in that regard. And I believe not much has been done, but the hope is more targeted interventions to such populations. Yeah.
Right. Yeah, you're right about the structural adjustment policies. They didn't really take a gendered lens, so there's plenty of room to do that in future. Yeah. Okay, well, thank you so much. I would open it up to any questions or comments. Well, while others are thinking about it, I have another question, and it relates to, you probably haven't looked at this, you haven't addressed it specifically in your study, but just in terms of future research, would you be extending or repeating this with the next cycle of data that's available? And if you are, would you look at impact of rising temperatures on lifespan, and whether it actually, there's a gender difference, and I'll just leave it open to you.
I can take this one. So the SAGE data set, I'm not sure if it's the best to address lifespan, but definitely, since we're expecting temperatures to go up, it is quite likely that we'll see differences in quality of life, for example, because that's something that's asked in the SAGE data set. And taking a gender lens would also be something that would be possible.
Yeah. No, thank you, Gabriel. But just to add to it, the SAGE has a third wave. This is wave 2. Wave 3 they just finished the data collection, and accessibility sometimes can be a problem. But once we can get access to it, then we can look at how changes in temperature, how the changes may be resulting in changes in cognitive function, changes in sleep quality. We can run the analysis at a longitudinal level to look at the life course perspective. But that also brings in one of the studies we have been thinking about, one to do a critical review of various studies that have looked at how increasing temperature impacts on health from a life course perspective, because it appears there are gaps in the literature, and one cannot tell whether there are gaps when you look at the effect of ambient temperature on, let's say, pregnancy, the effect of ambient temperature at childhood, and the effect of ambient temperature at older age, right? The other component of it is also to explore whether there are, and if there is not, then we focus on it, whether experiences at a younger age seem to have an effect at the older, when the person gets to adulthood. Would this be something we found out with, let's say, adverse childhood events, right? But would we experience same when you think of climate change? This been, I think, the focus on climate change has been more pronounced in the last 10, 15 years. And so I don't think so much has been focused on. There's been separate studies on, let's say, temperature and the health of children, temperature and adolescents, temperature and older adults. But I don't think there's a particular study that has looked at it consistently. And it will be a fantastic study. Certainly, I'm beginning to think that there's a data set in Canada that on aging, the Canadian longitudinal study on aging. It has some particular measures, and I think last year they introduced these climate metrics into it. And so the hope is beyond the data we are using on sub-Saharan Africa or on Ghana, we can look at the Canadian setting and see if we are finding similar trends. The good thing with the Canadian data is it also has some direct health data and administrative data embedded within it that can also serve other functions. So yes, it's something we have thought about just last week, and we planning to work on it. Yeah.
Okay, great. Yeah, because even we're now, if you look at 2014-15 when the data was gathered, we're almost a decade past that, and there's been a lot more, there's been significant warming in the last decade, so it could be even worse than your data currently showing. So yeah, if you could update that would be really, really, really important. Yeah.
Maybe to reflect what you are saying, can we go to the map and I'll show you the difference? Because it wasn't made pronounced. So the map you've seen, the temperature map you've seen is for the 2014. You would find that the red zones are not as much here, but the map we are shown previously, the figure 1B is 2023, right? And you do see the red zones, which are more pronounced, showing very high temperatures. And so we imagine that the effect we've seen is probably an estimation of what is actually going on, but we have to speak to the data. If you are using this particular temperature data set, we imagine that the effect will be much more pronounced. And I don't think the socioeconomic status of several of the households we consider to have lower SES has changed that much, which then means that a lot more needs to be done now than ever. So that was to speak to your question and your concern.
And I wonder if you're looking globally, if there are any kind of global guidelines by WHO or World Health Organization or other organizations that are taking this kind of data into account.
Well, thank you so much for that concern or the question. The fact is, since last week, I've been with the National Institute of Health on grants focused on climate change and health, and we find that you have so much being tailored or targeted towards climate change and health, and they are paying attention because the goal is to fund several grants that would be working on running some of these models to tell us what is happening. But not just these models, they want to be able to predict at some point using machine learning at some point what is happening, what would be the effect on various populations based on the current climate changes we are seeing, as well as future changes. So it is not just, I don't think it is just the US that is focusing on it. I know that the UK is also focusing on it because of a grant call that showed up with the Wellcome Trust. Yes, and they were also focusing on it, looking at studies that would explore some of these relationships. So I feel like the world generally is trying to think of what are the events, what are the consequences of this for the populations we have, and how can we mitigate these. And it's not just the studies, but there's more emphasis on implementation science. What can we put in place, and are these adaptive strategies that have been suggested working, right? And the call, therefore, to be able to evaluate what has been put in place. For example, you think of nature-based solutions that have been suggested for some low and middle-income countries. Certainly, there is the positive aspect of it and the merits associated with it, but you have another school of thought that thinks that if you are going to implement it to the core, it has challenges for the socioeconomic status, the socioeconomic conditions of the people, because for some people, let's say it is their livelihood, source of livelihood, right? And so you have all these funding mechanisms and all these policies that are targeted at these strategies, and just to ensure that, one, they are equitable, but two, they are making a difference for these vulnerable populations.
Yeah, no, I could see that modeling would be very important. And then modeling, incorporating AI to try and predict, given all the variables, because it's so complex, right? You've got, it's sort of cascading effects, I could imagine, climate, because as you mentioned, with the increase in mosquitoes and other parasites increasing due to climate change, I mean, just the complexity of overlapping variables, it's going to be, predicting and mitigating is going to be probably what we're really focused on next.
And just to add, there is a lot of work being done, but there's also space for evidence synthesis.
Right.
Because various countries have their own policies on how they're tackling climate change, but there's not like a singular, like body of evidence to help more effectively target those policies.
Yeah, exactly. Almost like at a global level. I mean, it's like we're all struggling with it in different ways, and different countries are approaching it.
There's definitely an appetite to do the research, but there's also a space for all that research to be collected and shared.
Yeah. Fascinating.
And I think that also brings to bear the need to sort of have a compendium of best practices from case studies and from individual countries that could be shared globally, so that people could various countries could pick and choose which one works for them and which one would be suitable for their particular situation. When it comes to adaptive strategies, from my angle, I don't think a one-fits-all approach works, because what might work for, let's say, Canada would not work for Ghana, would not work for Angola, depending on what other factors, environmental factors, they are dealing with. Mind you, I would say sub-Saharan Africa, in terms of the carbon print, produces much less relative to the Americas and Asia, right? But they do face disproportionately a lot more of the consequences. And so if there is any support system, then the focus is sort of ground-based. How do we work with individuals, organizations based in those countries to develop solutions, adaptive strategies, and in some cases, they've already been, the indigenous people in those countries have already been using some strategies already, right? And so if we could leverage on those strategies and improve and build them up, then I believe we could be seeing a change. We could be seeing some transformation. I think some 10 or 15 years back, when I was in Ghana, I do remember that in certain places, people were not allowed to farm. The forest was left, and up to today, some of those places still have there are forest zones that have not been touched. This is about preserving biodiversity. But those days, what we knew it to be was culture that was saying, okay, these are forbidden forests, you cannot go in. But today, looking back, it appears that it served a scientific purpose, right? And so some of those indigenous ways and practices that had been used in conserving, let's say, the forest cover, in ensuring that certain habitats are kept intact, if we could leverage on that and not use sort of a top-down approach, that would really, really work. So these are some things we've been thinking of, and trying to figure out how do we ensure that this is taken at a level that works for everyone.
Yes, definitely. Incorporating the wisdom of our indigenous communities, they definitely need a seat at the table because, as you say, we didn't realize the value of some of the protective effects that they have, as not just biodiversity, but as carbon sinks. So to kind of reduce climate change even. Yeah, so very interesting. Any comments or questions for Godfred and Gabriel? I think we're all very impressed with the quality of the work you've done and importance of your findings. Please, Hannah.
I was wondering, in your research into these communities that are now heating up really quickly, is there anything that they're doing to kind of future-proof, like in certain areas across maybe North America more so, cities have been putting in more bike lanes to encourage people to bike more and drive less, take transit less, or like just planting more trees to help with the shade and hopefully provide, like make the summers less hot. So I'm wondering if any of those communities do that in Ghana or any other areas you looked at.
That's a very good question, and I smile because the country hasn't gotten to that level. In fact, the challenge has to do with urbanization, and you have a lot more people moving from the northern parts, which have become more humid, and the temperatures seem to be soaring higher and higher year by year to the southern part, which is a bit cooler. But that also means with urbanization, it comes with some consequences. The slums and informal settlements have just exploded, and when there is flooding, it is just serious. I mean, the consequences with let's say flooding in such places, as I had mentioned earlier on, you have a slew of diarrheal diseases, and I mean it's challenging, right? The infrastructure has not developed to the point where we would say that there are bike lanes here. That is common to the public, but I do know that there are pockets of development within Ghana where they have estates that are, I mean, similar to what you have here, and they have bike lanes. They have everything you think of that makes the environment sustainable. But this would normally be for middle income, upper income families who live in such settings, and that is probably less than 20% of the Ghanaian population, right? And so I do feel like yes, we can talk about bike lanes and all that, but the infrastructure has not gotten to that level where it is accessible to everyone.
Yeah, I think we're going to, a lot of the European policies on bike lanes and so on, and actually closing off streets to vehicles altogether. We're not there yet, for example, in North America, but yeah, it's really important. I think people haven't set their mind that way yet, but we've got to go there, otherwise we're all doomed. You have, you're nodding, but
oh yeah. I think the reason why we don't have a lot of that is because the way the cities are set up in the first place. I think we need to like rethink our urban design.
Yeah, absolutely. The importance of interdisciplinarity, which we try and promote at the Dahdaleh Institute. Yeah.
But I do maybe as we get to the end of the session, I do think there's a certain shift now to a transdisciplinary approach when it comes to dealing with the health consequences associated with climate change. And even with this research that we pursued, we needed individuals from different disciplines in order to be able to secure the data, combine the data, work on different measures. And so I believe the core, the emphasis or the focus on transdisciplinary approach and intersectorial approaches to dealing with this, I would say, wicked problem called climate change is now. I mean, we cannot wait any longer. We cannot continue to work in silos. And I imagine that we see similar things even here at York. You do see pockets of some of these studies here and there. I feel like it is about time we came together to look at the same problem, but looking at it from the different disciplines in an integrated way. That way, I feel like we would have more concrete solutions that would address this complex problem in a more holistic way than just doing it individually. I mean, the results of our studies we know are quite novel. However, if we had scientists who are in gerontology join us, if we have individuals from EUC, environment and urban change, it will make a very big difference in terms of what solutions could help out with some of these challenges.
Yes, I agree. I think that's where the innovations are going to come from interdisciplinarity, because it forces scholars to think in different ways, right? To stretch their approaches and look at different angles. And yeah, so I do agree that's the future. So, okay, any last burning questions or comments? Okay, well, thank you so much, Godfred and Gabriel, for some really fascinating research, and wonderful, Gabriel, that you're able to come back to the Dahdaleh Institute and
Good to
share.
be back.
Yeah, and well, all the best to you in your career now at downtown.
Yeah.
St. Michael. Yeah. All right. Well, thank you so much, Jane.
Thank you.
I guess our session is ended.
Thank you, Mel.